All right, so our second session is chaired by Dr. Don Northfelt. Where is Dr. Northfelt? He's on his way up here. Many of you know Dr. Northfelt. He's been with us here for, I think, the better part of 15 plus years now. Dr. Northfelt is a consummate clinician. There's very little in the realm of hematology or oncology that he's not expert at. He's someone that we all very much look up to. He also is very much a thought leader in integrative medicine, if you will, and thinking about the whole patient, these topics that we're talking about today. This session that he's going to run this morning is going to be a panel discussion, so he's going to introduce the rest of the panel, and then hopefully I think you'll find it very riveting. Great, thank you. Thanks, Tom.
So I'll ask my panel members to join me up here, Dr. Chang, Dr. Niska, Ms. Kwitek, and Ms. Bosselman. We're going to talk about cancer myths. I think my title slide, maybe you flip up the title slide, guys, just so everybody knows what we're talking about. Thank you all. That's not me. Maybe back up one. We got the title of Cancer Myths for this talk, and that wasn't exactly the title I was looking for, because I'm not sure there are myths about cancer. What I wanted to address today was the idea that, in this day and age, there's news and then there's fake news. And in this day and age, there are facts and there are alternative facts. And what we have to realize is that we all look at these things in different ways and we come to different conclusions. At the Mayo Clinic, we're primarily using the scientific method to direct us into what we believe is real and important and necessary for your care. But when I see patients in the clinic every day, they'll come in with ideas and concepts and questions that sometimes get to the fringe of what we know or what we believe. And I think it's our challenge in taking care of people to try to address those things in the most meaningful way possible. So in other words, nothing is wrong, nothing is fake, but there are nuances about what we know about cancer, and we have to find that common point, that meeting ground with our patients and with our colleagues to know how to best take care of you. So I chose 4 topics that come up quite often in the practice, and I want to address these with the help of my panel. These are people who are experts in the topics that we're going to address today. Ms. Bosselman on the end here is a registered dietitian, and she's a master's trained exercise physiologist, and she's also a massage therapist. So she has a background that informs her about certain questions that we'll bring up today. We have Dr. Niska, who's one of our senior residents in radiation oncology, and he'll bring a special perspective to a question I'm going to pose. We have Ms. Kwitek, who's a registered dietitian, again, specific questions that touch on her area of expertise. And then Dr. Chang is one of our senior surgical residents, and I have a question to pose to him that may be on some of your minds as well. So I'll start out by asking a question of Ms. Bosselman about coffee. And it's a latte. It's a latte. Yeah. So Ms. Bosselman, I encounter patients in the clinic who come in and proudly tell me that because they're worried about cancer, because they've just been diagnosed with cancer, they've cut out all coffee. They're not going to drink any more coffee because they know that that's bad for them because of their cancer concern. And I'm puzzled by that, honestly, because when I look at the scientific literature, I don't necessarily see where that has come from. And I'm wondering, as a registered dietitian, if you could comment for us on this question of whether coffee is bad. It is a latte. It is.
Thank you, Dr. Northfelt.
Yeah, you have to speak really forcefully into that microphone.
Speaking loudly is not my forte. Hello, everyone. I'd like to address the question as presented, but I'd like to start with a quick analogy to help you understand maybe where that information came from. We know that people who consume large quantities of red meat are more likely to be at risk, as studies have found, to be at risk of heart disease. And so we all decided that red meat was evil and bad and we needed to shun it. But what we did then is looked at a little deeper into the studies and found that people who regularly ate large amounts of red meat also engaged in other high-risk behaviors. You can imagine what those are. They probably didn't eat very well otherwise. I doubt there were a lot of broccoli and asparagus on the plate with the meat. And also, they were not physically active, and they usually also were more prone to smoking. The same is true with the information or the studies that people have looked at in the past about coffee and cancer and the association of it being bad. Is what they found is that people who drink large volumes of coffee were also those same people that engaged in the various high-risk behaviors. So those people were also not eating well, they were not exercising, and they could be smoking as well. So you have to look at, you have to peel the layers back to decide what the information is that you're looking at. So moving forward, the International Agency on Research for Cancer did a almost 3-decade retrospective of all of the science-based literature and information that's available to us. That's a long time, that's a lot of studies for those of you. Some of you may think about that in terms of decades of how long you've been around and think of how much you've seen and known in that time. And they found that there was no association, I'll say that again, no association between coffee consumption and cancer at any body site. So for any type of cancer, be it in the mouth, be it in the stomach, anywhere on the body, there was no association. So with that being said, I want to bring up 2 caveats. The first one is the amount of coffee that's consumed. So some of us may think that's a subjective question. And the studies in general was concluded that 3 to 5 cups a day was considered moderate consumption, and that was indicated to be okay. Now let's clarify that a little bit deeper. That would be 8-ounce cups, not 20 or 60. As much as we all enjoy a big, big mug to put our hands around, it would be an 8-ounce cup, no more than 3 to 5. And the second caveat would be what you put in the coffee. That obviously changes the beverage considerably. And we just talked about latte. Hopefully that's real milk that you're using and not artificial creamer, which has a lot of ingredients in it that could contribute to a disease state, as well as the sugar. So the bottom line here is you can enjoy your cup of joe without stress and use it as a way for good morning rituals, socialization, and connection. I hope that answers your question.
Did everybody notice that as soon as she said coffee was not a problem, the other panelists raised their cups? There you go, there you go. I love it. How about coffee preventing cancer? How about coffee helping somebody who has cancer? Dana, what would you say about that?
Yeah, there's actually, when they did that large multiple decade review, they found that people who had liver cancer and uterine cancer, there were some preventative benefits associated with coffee consumption.
Great, thanks. Another question that I hear fairly frequently in my practice comes from patients who are facing a biopsy or facing an operation for their cancer. And what comes to their minds is that when the surgeon pokes that cancer or cuts that cancer, it's going to spread. There's going to be movement of the cancer through the body caused by the disturbance that the surgeon causes with the procedure. And again, there are nuances about this. There may be situations where that could be a concern, and then there are other situations where we don't concern ourselves with that so much. But rather than hear that from me, I thought we'd get an expert to comment on it. Dr. Chang is our chief surgical resident, and he probably faces this question in his practice much more than I do. So I asked him to come and comment on the question of whether cutting the cancer or poking the cancer makes it spread.
Thanks very much, Dr. Northfelt. So I actually remember growing up with this question from my grandparents, that a friend of my grandmother's had cancer, and then she had surgery for it, and then suddenly it was metastatic. She was like, they shouldn't have messed with it. Shouldn't have let the air in. Overall, we found that biopsies are safe. Biopsies, and again, like Dr. Northfelt said, there are certain tumors that biopsies have to be done in a very specific way so that if they do spread any cells, then we take them out at the same time as we take out a tumor. But for the vast majority of patients, a biopsy is a necessary and vital part of their diagnosis so that we give them the right treatment and the right therapy. The risk of it spreading tumors for, again, the vast majority of cancers is little to none. In terms of actually doing surgery for cancer, as a specialist for surgical oncology and taking out tumors, we do a lot of different techniques to ensure that tumors don't spread when we're taking them out. This involves sometimes taking some rims of healthy tissue around the tumor so that we never actually touch the tumor itself. Or for instance, in the case of, let's say, breast cancer, when we do reconstruction at the same time, our plastic surgeons use an entirely different set of tools to ensure that whatever tools we use taking out the cancer don't go back into the patient afterwards. It's a little bit like taking your car to the mechanic. So I did this recently where I had a small oil leak. Well, it turns out I also need new shock absorbers, new bushings, and my steering realigned. So I don't think that the mechanic did that to my car, but now that he's looking for something, sometimes we do find other problems once you start looking for it.
So Dr. Chang, would it be fair for me to say to a patient who has this concern something like, we understand the concern, but we've got you covered?
Something like that.
All right. Dr. Niska, I know that when we were trading emails about this lecture, you had a comment about this issue of spreading the cancer with surgery, and it comes from your perspective as a radiation oncologist. Could I get you to comment on that?
Yeah, sure. So most of the time, as Dr. Chang commented on, it's not really an issue, and we have good data in terms of looking at patients who've had biopsies or other procedures showing that there's not a risk of spreading the cancer from those procedures. But in the instances where we do have information that biopsying a certain type of tumor or a certain type of tumor has an increased risk of coming back at the surgical scar where the surgeon might have manipulated the tissue, we actually, in the radiation side, after the patient has had surgery, provide extra dose of radiation to that area or potentially cover the tract where the needle was if we're concerned about the tumor coming back along that tract.
I guess I should take a second just to circle back and ask both Dr. Chang and Dr. Niska, what do you tell patients when they come in and express concern about coffee?
I'd send them to Starbucks.
Yeah, I would echo that.
All right, so you've got a fairly unanimous opinion, folks, that you're okay to have another cup. I'm going to talk about another question that I hear quite often, but I want to ask the audience first. How many people have heard that soy is bad to have cancer? How many people have heard that? All right, a fair number. This is something that's been circulating around in the medical literature and in the lay literature for decades. And as a breast cancer physician, I very frequently get questions about soy. Is it safe? Or I'll have patients come in and proudly proclaim that they have gone through their cupboard and removed every item that has soy ingredient on the label. And that pretty much leaves their cupboard bare. But I want to ask Ms. Kwitek, who's our registered dietitian at the Mayo Clinic Cancer Center in Arizona, if she could comment specifically on the safety of soy and soy products for patients who have cancer or who are concerned about cancer.
Yes, unfortunately, this is a question that I get very frequently in my practice as well. So I'm glad that Dr. Northfelt asked me to speak today to help dispel some of the myths, maybe put your mind at ease, and answer those questions for you. So I would like to talk about both the benefits of the soy and then, hopefully give you that ease of mind and let you choose or let you start to eat those soy foods again if you have cut them out or if you have been nervous to add them in. And so what is soy? So soy is found in foods like soy milk, edamame, and tofu. And it's actually a food that contains all of the essential amino acids, which makes it equivalent to an animal protein. It's also very high in fiber, vitamins and minerals, iron, omega-3 and omega-6 fatty acids, and then it's very low in saturated fat and doesn't have any cholesterol. So because of all of these things, the American Heart Association actually says that eating soy is beneficial for cardiovascular health. Some soy foods are also high in calcium, which makes it very beneficial for bone health. Soy can help reduce the frequency and the severity of hot flashes for women going through menopause. Soy is also beneficial in exercise, athletic performance, and muscle recovery because it helps reduce the oxidative stress that comes along with exercise. And soy also helps increase satiety and decreases snacking, which makes it really beneficial in weight management and in blood pressure control. Another benefit of soy is that it contains phytoestrogens. And this is where I think a lot of the confusion arises as to whether or not soy is truly safe to eat. Phytoestrogens are plant estrogens, and they have antimicrobial and antioxidant benefits. But many people are afraid to eat these phytoestrogens because they think that this will increase their estrogen levels in their bodies. But research has shown that eating moderate amounts of soy does not increase estrogen levels. Now, structurally, phytoestrogens are similar to the hormone estrogen, but they act very differently in the body and they're much weaker than estrogen. And along with that, phytoestrogens actually have some anti-estrogen properties in that they help to block estrogen from binding to estrogen receptors. So many breast cancer patients come to me and are afraid to eat soy or they've cut it out because they think that eating the soy will make their breast cancer come back. And studies have shown that women who eat moderate amounts of soy don't have any increased risk of breast cancer or that it may actually have a preventative benefit. And even in women with estrogen receptor positive breast cancers, eating soy actually has been shown to reduce the risk of a recurrence, even in those women with the estrogen receptor positive breast cancers. So what is a moderate amount of soy to eat? So a moderate amount of soy has been shown to be eating 1 to 3 servings of soy on a daily basis. And so a serving would be something like a cup of soy milk or a half a cup of tofu or edamame. And for a lot of people, eating soy is pretty rare to begin with. So 1 to 3 servings sounds like a lot. But again, eating that moderate amount of soy has been shown to actually be beneficial rather than increase your risk of breast cancer or many other types of cancers. Now with men, a lot of men are apprehensive to eat soy because they feel that or they think that soy will increase their estrogen levels. But again, the research has shown that eating those moderate amounts of soy does not negatively affect male reproductive hormone levels. So, because of all of these great health benefits, if you have been avoiding soy or really questioning the safety of eating soy, just know that there are all these benefits. It's a great source of protein. It has all of those other great vitamins and minerals. Don't be afraid to eat soy. Now, like with any other foods, we encourage people to avoid processed foods in general, and that would go right along with the foods that you choose related to soy. So choosing those whole soy foods like, the edamame, the tofu, the soy milk, unsweetened soy milks, those are all safe and great sources of soy to include in your diet.
I should have provided more full disclosure. This is actually a soy latte. And I always order soy because I read or heard somewhere on the internet, I think, that soy is good for prostate health. What does the panel think about that? Let's ask Ms. Bosselman.
Soy is absolutely fine for prostate health as long as it's in the form of unprocessed whole food presentation. That it's an edamame, it's the whole soybean, it hasn't been altered. So basically, as Michael Pollan says, if it was made in a plant, avoid it. If it was grown in the ground as a plant, eat it.
Just out of curiosity, Dr. Chang, do you get nutritional questions in your surgical consultations from patients?
I do, and I refer to my colleagues and dietitians very heavily for a number of those questions.
Great. So you ask your patients to go straight to the authorities.
It's a multidisciplinary clinic. I'm very blessed to have so many other good specialists working with us.
Right. We've had oncology nutritional care at the Mayo Clinic Cancer Center in Arizona for about 6 or 7 years now, and it's been an enormous benefit to our practice to have dietitians with these skills available. I want to ask another question of the panel. Sir, go ahead.
Under the heading of soy and estrogen, I've had the wonderful pleasure of having estrogen therapy for the last 7 years.
Mm-hmm.
And needless to say, it's dropped my testosterone dramatically. I'm curious as to, does that, all those answers about soy equate the same way when a male is under estrogen therapy?
Sure. So, panel, the question is this. If you are a patient receiving anti-testosterone therapy for your disease, is soy a safe thing to add to your diet or to have in your diet? Anne, maybe you could answer that.
I would say yes.
Mm-hmm.
Just because of all of the
So the gentleman is saying that when he uses soy, he experiences more side effects. I guess my response to that, sir, would be, if something doesn't feel good, don't do it. Yeah.
The thong started feeling better.
Okay. I'm not going to repeat that comment. Another common question I get in my practice relates to radiation therapy. And, sir? Example of unprocessed soy, Dana? Unprocessed versus in the plant. Is there a distinction?
Unprocessed soy is just simply as it appears in nature. It's the whole soybean. That's what the edamame is. When you eat that, you pull the bean out of the pod. That's the soybean. When we milk the bean overnight, we get the soy milk. When we eat a protein energy bar, where's the bean? Right? We don't see it anywhere. It's because it's been extracted component of the soy, turned into an isolate, and then added into the protein bar. So that's the processed soy. That's the kind that doesn't do us any benefit.
Go ahead.
Asian cultures, by and large, have a high soy content in their diets. Is there any indication, scientific indications, that they have less certain types of cancer because of it?
And what about the soy content of diets in Asian cultures? Has that been shown to be relatively a good thing, or is there some detriment that's seen in cultures that consume a lot of soy?
So Asian cultures have been studied specifically related to their soy intake, and actually women in Asian cultures have significantly lower breast cancer occurrence. And so this is where a lot of the thoughts came from related to eating soy and lowering that breast cancer risk.
I want to make a comment about one of the afternoon sessions today. There's a 3:30 session on nutrition, where all of your questions about nutrition have a chance to be answered. And the dietitians who've set up that 3:30 meeting today, they want it to be a Q&A, question and answer from start to finish. So out here at one of the tables, Ann will tell us where, there's a pile of cards where you can write down your nutritional questions. Those are all going to be submitted to this panel of dietitians at 3:30 this afternoon so that all of your questions about nutrition can be answered. I recognize that in a session like this, we're just sort of scratching the surface. There are a lot of in-depth questions that we would love to answer for you, and that's why the organizers of this conference set up a complete session devoted solely to nutrition, which is at 3:30 today. So look for that on your program, and please strongly consider attending that. I'm not just saying that because I'm going to be there and it's one of my favorite sessions. I'm saying it because I think it's a good session. So please be sure to attend that this afternoon and get your questions on a card that you can get out here in the lobby. Sorry? At the information desk where you signed in perhaps on your way in today, you can get a question card for the dietitians for the session after lunch. Another question that comes up frequently in my practice is a fear, a concern or a fear about radiation therapy. We, as part of our multidisciplinary care of cancer, send a lot of our patients for radiation oncology consultations because we have the science that tells us that giving radiation in certain cancer situations is going to be very beneficial. However, many patients will express a fear of radiation because they specifically have learned that radiation causes cancer. So why, if radiation causes cancer, am I sending a cancer patient for radiation? And we brought Dr. Niska, who's our senior resident in radiation oncology at Mayo, to answer the question of why are you doing that to people?
So I have to apologize. My notes are on my phone, so I'm not checking Facebook. This is a question that I think I talk about with just about every patient who comes through our department. And I know that the title of this session is Dispelling Cancer Myths. I would call this a cancer half-truth because the short answer is radiation can cause cancer. So for the general population, there's background radiation from radon in the earth. There's radiation that you get on airplanes or from diagnostic scans that actually can, over time, lead to a low risk of additional cancer. But the more accurate answer is that radiation kills cancer cells very effectively. On the other hand, radiation can damage normal tissue cells, and those normal tissue cells usually repair, but over time can have a mutation that does ultimately lead to a cancer. So I think to get into the nuances of the question, understanding how radiation works actually is helpful. So radiation works by damaging DNA. DNA is in every cell in the body, and it's the roadmap that the cell has for building and growing and becoming the type of cell it needs to be and performing its functions. Radiation, whether it's from natural background radiation or radiation for treatment, damages DNA. Normal tissue cells are really good at repairing DNA damage. That's why everybody who goes into the sun doesn't get skin cancer, because their skin is very good at repairing damage from radiation in the sun. The same is true of the radiation that we use for therapy. So normal tissue cells are very good at repairing the DNA damage from radiation therapy. There's obviously side effects that over time get better as the cells heal, but those cells repair their DNA and don't have persistent mutations or aberrations that lead to cancer. Cancer cells, on the other hand, are notoriously bad at repairing DNA. And that's actually how a lot of chemotherapy treatments also work, by inhibiting cancer cells from repairing or duplicating DNA. So those cancer cells, when they get damaged from radiation, aren't able to fix it and they die. And so really, it becomes, just like any question in life, a question of balancing risks. So for the average person who is walking down the sidewalk, we don't want to unnecessarily expose them to undue amounts of radiation, because yes, it can lead to a cancer down the road. But for someone who has a cancer that's being treated, radiation can be very beneficial in killing cancer cells. And so we always have a very informed conversation with our patients about what those risks are. For patients who have a cancer that radiation is a necessary component of curing the disease, the balance is, on one hand, a disease that could take someone's life and radiation being able to cure it, versus in about 10 years, a 0.1% risk of another malignancy caused by radiation, which ends up being about 1 in 1,000 patients. That obviously varies based on age and what we're treating. So younger patients have an increased risk of radiation causing a malignancy down the road. They have more time in front of them to develop those cancers caused by radiation. We also have to consider what the baseline cancer risk is for, the average person who's living here in the Phoenix area or in the United States. Younger patients or younger people have about a 1 in 1,000 risk per year of developing a cancer. Older people in their 60s, 70s ultimately have a risk of about 2% as they get older of having a cancer develop per year. And that's just at baseline. Radiation, if we treat somebody with radiation, adds a very small sliver to that baseline risk. And it's oftentimes very hard to tease out what cancers could have caused by radiation, or which cancers were just the risk the patient already had. So for the example of breast cancer, like in Dr. Northfelt's clinic, for the average breast cancer patient, our radiation might reduce their risk of the breast cancer coming back by 5 or 10%, depending on the patient. So that's a real reduction of 5 or 10%, so 1 in 10 patients not getting a recurrence, or 1 in 20 patients not getting a recurrence of breast cancer 10 years down the road, versus roughly 1 in 1,000 risk of 10 years down the road, the radiation that we used actually causing a cancer. So if you do a little bit of a division, it's about a 100 times extra benefit of having the radiation versus the risk of the radiation causing a cancer. The one other thing I would add is that we do our best when we deliver radiation to not deliver excess amounts of radiation to normal tissues, both to stop side effects that patients might have, but also to reduce the risk of second cancers. Many of you might know or have been treated at our proton center, or have family members who have been treated at our proton center. And proton radiation reduces the integral dose, meaning the dose that all of the normal tissues on average are getting, by quite a bit compared to our standard radiation. So for example, patients that we know have a very high risk of developing breast cancer after radiation are young women with Hodgkin lymphoma, because we oftentimes need to treat in the chest right behind a young developing breast. Historically, they had excess risk of developing breast cancer of 5 or 10% or even higher by the time they reach age 30. But with proton radiation, we can essentially reduce the dose to the breast to 0. And so We don't have 30-year data yet with proton radiation, but if the dose to the breast is 0, then their excess risk should also be somewhere close to 0.
Well, folks, it's 9 o'clock and I have to give up the podium to the next speaker, but I want to just, as I'm walking up here, ask the panel for some quick votes. How many on the panel believe that smoking causes cancer? All right, there you go. How many believe that a glass of Cabernet Sauvignon causes cancer? Whoa, nice, nice. How many of you believe that cell phones cause cancer? We got, okay, a little bit of a maybe there. High tension power lines, cancer? Okay, we could go on all day, right? But I have to give up the podium. So I want to thank our panel. They've done a wonderful job in helping us understand a little bit more in depth what's news, what's fake news, what's fact, what's alternative fact, and so forth. So thank you very much, panel.